concussions and concussion prevention in football. So for this, we're going to be doing a case study on a fictional football player named John Smith. He had to retire early because of a history of repeated concussions. So what is a concussion? According to Yale Medicine, concussions occur when a sudden movement causes the brain to bounce against or around the skull. This can damage brain cells and bring about chemical changes in the brain that alter how the brain works in the short term. So how concussions work neurologically. So when John Smith experiences a concussion, his brain is bouncing around within his skull, and the neurons within the brain are being stretched, and some of them are being broken. There's this damage to the neurons that would result in a trouble in regulating the flow of ions and ultimately the impairment of the cell's function and thus overall brain function. So some short-term symptoms, just to list a few: nausea, which can come about from damage to the areas that regulate nausea, as well as trauma induced from the injury; headaches, which is affecting brain function from the damaged neurons, can lead to headaches. It can also be because of the changes in the blood flow to the brain. Sensitivity to light, because of the inhibited function in the thalamus, which is the main relay station for sensory information, which is visual. The thalamus may become overwhelmed because it is having its functions inhibited while still trying to receive the same amount of sensory information. This was why we may have experienced pain to light. We have ringing in the ears, fatigue, and vomiting. So, John Smith, during his career, experienced multiple concussions and chose to retire and seek out a neurologist. The neurologist told him that he met certain biological markers of CTE, or chronic trauma encephalopathy, a neurodegenerative disease that is caused by multiple head injuries and is very common in the sport of football. CTE is caused by an abundance of the tau protein, which is a protein that is responsible for maintaining the shape of the neuron. The research done on these proteins during CTE is not conclusive yet. The research suggests that the protein disrupts the activity of the cell and communicates to other cells to build an abundance of tau proteins as well. It is the inhibition of the cell which ultimately kills the cell, which is why we see in that advanced CTE picture the degeneration of the brain. Because of the degeneration of the brain and the neurons within it, CTE would cause John Smith to have trouble remembering information. He would have a change in his personality, which would make him angrier. He would have a declining cognitive capabilities, and he would have symptoms that are similar to Parkinson's as well as dementia. Some prevention methods that have now been instated. We have guardian caps in the NFL. So this is a thing that the NFL agreed upon in 2024 to allow players to wear these guardian caps in game. They are a soft shell that is placed over top of the helmet to reduce the impact from contact and to disperse it more within the helmet and not within the head and neck. These guardian caps in 2022 preseason resulted in 52% reduction in concussions, and when both players were wearing it, 50 to 20% decrease in the impact of, in the severity of the impact. And then in Ontario, we have Rowan's Law, which was adopted in 2018. It provided protocols on how concussions are managed in amateur competitive sport. So it has now changed the culture around concussions and made it so that when we notice concussions and we try to notice concussions, we remove the player from the sport and we assess them, and then we give them an active timeline as to when they will be able to return to their everyday life and as well as when they will be able to return to everyday sport.